trying to stay safe. Governor Northam, there are a lot of callers who are already calling for you. I have questions. Tom has questions. So I'll ask you to try to keep your responses as brief as possible. But here goes. You have issued a stay-at-home order for Virginia residents this week, but in a Washington Post piece earlier this month, Robert McCartney compared your response to the virus to that of D.C. and Maryland, noting that your orders to close schools, issue a state of emergency, and shut down eating at restaurants came much later than Maryland and D.C., and you've drawn criticism from some fellow Democrats for lagging behind. Why didn't you move more quickly, and do you regret not doing that?
This has been a very dynamic pandemic, and I'm doing everything that I can to keep Virginians safe, also to give them accurate and updated information. And Kojo, we've done taken some aggressive measures, such as you just mentioned, closing down our schools. I was one of the first to do this, closing down our restaurants to everything except takeout and home delivery. As you know, we have a stay-at-home order that is in effect through June the 10th, which is longer than anybody else's. So we've been very aggressive, but each state has done what they have felt is in the best interest of their people and constituents. And there's been or certainly a lack of leadership at the federal level. So the responsibility, the leadership has really landed in the laps of the governors. And I've been in touch with our governors almost on a daily basis, and I think we're all doing what's in the best interest of our states, but working closely together.
Tom Sherwood.
Hey, Governor, welcome to the program. You have a state that is quite large. People don't quite realize, from Loudoun County in Northern Virginia to Lee County, which is further west than Detroit, Michigan. But you have to address the entire state. Mayor Bowser this morning said that she expected the peak of this public health crisis, to occur in late June, maybe early July even, and that where do you see the peaking of the virus in the state of Virginia, and what would you be saying to Northern Virginians about what they should expect?
Yeah, it's a great question, Tom, and I've been working very closely with the mayor of Washington and also the governor of Maryland, and we're looking at different models. I think to just kind of put things in perspective, we're dealing with an unknown virus. We don't even know if it's seasonal yet. There's no vaccination. There's no treatment. And so a lot of unknowns, which has been quite a challenge. We are looking at different models, kind of averaging them out, looking at the data. As you know, I'm a doctor, so I'm all about data, talking to a lot of specialists, experts, epidemiologists. So our peak looks to be in May. And the curve on the backside of that is questionable. So I have told Virginians all along, this is not a matter of weeks. It's a matter of months. And there's been no sugarcoating. I've tried to give them the truth. I think that's what Virginians want. But we're in this for the long haul. And so we're looking forward or toward the surge, which we think will be in the May time frame.
Here's Robin.
Your counterpart, Governor Hogan, is the head of the Governors Association. He's a Republican. He's been reluctant to criticize President Trump in the past, but he has been quite critical more recently. And while everyone wants the governors of the country to work with the president and the White House and the Congress, there are legitimate criticisms that the White House did not respond quickly enough to support the states. Where are you on that spectrum?
Well, I've been working very closely with our governors. We talk 2 to 3 times a week. As you know, Governor Hogan is the chair of our NGA, our National Governors Association. So we have put our thoughts and ideas together and funneled them to the president. We talk to the president, the vice president, and his experts usually once a week. But the way I would describe this, Tom, is that the president has taken an aspirational approach to this. Governors have had to take a realistic approach. And so this virus started in this country on January the 21st. And we heard from the president that things like it was going to be fine, that the virus was very much under control, that 15 cases will go down to 0 in a couple of days. On February 27th, he said it would disappear like a miracle, said that everybody could, be tested. It was a beautiful test. Has told the governors on several occasions that the cure is worse than the virus. So that's one thing to be aspirational. As you know, I'm a doctor. It's one thing to tell someone you're going to be okay, but they need to know the truth and know what's ahead of them. And so I think on behalf of the governors, that's what we have really tried to do, is to take leadership roles and to tackle some very, very difficult challenges and make some difficult decisions.
Here's Robin in Arlington, Virginia. Robin, you're on the air. Go ahead, please.
Hi. Thank you for taking my call, and thank you, Governor Northam, for being on today's show. I'm president of Arlington Friends of Urban Agriculture, and we're a nonprofit focused on creating a sustainable and local food economy throughout Northern Virginia. And my question is about farmers markets. We were very concerned that your executive order did not deem farmers markets as essential businesses like grocery stores. And whereas Maryland and D.C. have done that. And we feel that farmers markets are a critical component of a secure local food system.
Allow me to have the governor respond to that, Governor Northam.
Robin, thank you very much. As you know, I grew up on a farm, and so the farmers markets and the access to nutritious food is critical. I agree with you. The farmers markets will continue to be open, but certainly with restrictions. We need to maintain our 10 or less, our social distancing, our good hygiene, wiping down surfaces. So all of those things are being done, and as we get into the spring and summer months, I think that's an essential a way that our means of people being able to get the nutrition they need. So I appreciate all that you do for agriculture and all that you're doing for our farmers markets.
So you're saying at some point, Governor Northam, you will declare farmers markets essential?
Oh, they already are, Kojo. People can go to the farmers markets as long as they abide by the guidelines that we've put forward.
Documents from the House Oversight Committee released this week showed that Virginia received significantly less personal protective equipment from the federal government than it requested. The New York Times reported that you requested 350 ventilators from the federal government and got none. Is that correct? What medical equipment have you received?
Well, it's a great question, and it's certainly a challenge, something that I'm very concerned about. We want to make sure that our hospitals are equipped to take care of the surge of patients that, again, we expect to come in the following weeks to month. And so ventilators, Kojo, is certainly an issue. We did not receive any ventilators. And I understand a lot of those resources are going to, cities like New York and New Orleans right now. But we will need more ventilators. Another area is our PPE. States are literally competing for the same supply, and that has been very chaotic. We've had manufacturers step up. We've had volunteers in Virginia step up. So we've also ordered PPE from overseas, which hopefully will be delivered in the next few days. So we're ramping up for what we need, but it's been a very chaotic situation, again, because we haven't had any direction from the national level.
Tom Sherwood.
Governor, you're trying to work with the president, and you've called his remarks aspirational. Others might have said they're simply political denial of what the country is facing. Back when you campaigned for governor, you at one point called President Trump a narcissistic maniac, and I know you've long since dropped that. Right now, in the White House briefings every day, there's clearly some possible new plan which is going to tell every person in the country to wear some kind of casual mask, not to wait till you get sick, but just if it's a scarf or something else, homemade. Again, as a doctor, what is your understanding and feeling about what people should do in terms of should they just wear a mask of any type when they go out into public?
Tom, I appreciate the question, and I certainly wouldn't discourage anybody from wearing something over their face when they're out and about, especially if they're around a lot of other people on the sidewalk, street, etc. But I do want to emphasize we desperately need to maintain all of the equipment that is available, to include masks, to protect our first responders, our healthcare providers, social workers, etc., because we're desperately short in those areas. But as far as someone, if they have a scarf or a handkerchief that they can put over their face when they're outside, I certainly wouldn't discourage it.
And if I could follow up on this, Governor, I think in just a few days, you'll be looking again at the state budget. I think something like $135 billion over 2 years. The district and all the states are having terrific troubles. What can people expect in terms of the laws that were just passed by the legislature, like increasing the minimum wage and other pro-worker type bills that some people are saying should be delayed because the county and the states won't have the money?
Yes, Tom, two different questions, I think. The first is the budget, and we had a great budget 4 weeks ago. We're the best state in which to do business, as you know, but things have changed. And so as far as new spending, all of that will be put on hold. The legislature will come back on April the 22nd for a reconvened session. And I've already had discussion with a lot of our financial leaders, our legislators, and so we'll make plans of how we move forward over the next few months with no new spending, but no definitive plans have been announced. As far as the pieces of legislature the new laws that were passed that are affect the business community, we're looking at those. I have a couple more weeks in which to work on those, but certainly listen to people across Virginia, businesses, etc. And we want to do everything that we can to maintain a strong business environment, because we need to come out of this strong, and I'll do everything that I can to keep us in that posture.
Afraid we don't have any more time, Tom Sherwood. We're out of time in this segment. Ralph Northam is the governor of Virginia. He is a Democrat. Governor Northam, thank you very much for joining us.
Thank you, Kojo and Tom. And remember, keep your social distancing and wash your hands frequently. We'll get through this together.
Once again, thank you very much.